Hello, and welcome. Today we're diving into a condition called bladder clot retention. We'll explore what it is, why it happens, and how it's managed. This condition can be uncomfortable and even serious if left untreated, so understanding the details is crucial. So, what causes bladder clot retention? The primary culprit is bleeding within the bladder. This bleeding can stem from a variety of factors. These include urinary tract infections, bladder tumors both benign and cancerous, injuries to the bladder from trauma or surgery, complications following procedures like prostate biopsies, radiation therapy affecting the pelvic region, and certain blood clotting disorders. Sometimes, even vigorous exercise or certain medications can trigger bleeding in the urinary tract, leading to clot formation. Now, let's discuss the pathophysiology, or how this condition develops. When bleeding occurs in the bladder, the blood begins to clot. These clots can vary in size and consistency. The problem arises when these clots accumulate and obstruct the flow of urine from the bladder through the urethra. This obstruction causes the bladder to become distended, leading to discomfort and pain. The back pressure can also affect the kidneys if the obstruction is severe and prolonged. Furthermore, the presence of blood and clots in the bladder can irritate the bladder lining, worsening the symptoms and potentially leading to further complications. Understanding how common bladder clot retention is can be challenging, as exact numbers are difficult to pinpoint. It's largely dependent on the underlying conditions that cause bladder bleeding. It's more frequently observed in individuals with pre-existing urinary tract issues, those undergoing urological procedures, or those with conditions that affect blood clotting. The incidence also increases with age, as the risk of conditions like prostate enlargement and bladder tumors rises. What are the signs and symptoms to look out for? The most prominent symptom is the inability to urinate despite feeling the urge. This is known as urinary retention. Other symptoms include lower abdominal pain or pressure due to the bladder distension, blood in the urine, also known as hematuria, which can appear as pink-red or even dark brown urine, a feeling of incomplete bladder emptying, and potentially, if an infection is also present, fever and chills. How is bladder clot retention diagnosed? The diagnostic process typically begins with a thorough medical history and physical examination. A urine test is crucial to confirm the presence of blood and rule out infection. Imaging studies, such as a bladder ultrasound or CT scan, are often used to visualize the bladder and identify clots or other abnormalities. Cystoscopy, a procedure involving inserting a thin, flexible tube with a camera into the bladder, allows for direct visualization and can help determine the source of bleeding. While bladder clot retention doesn't have distinct types or classifications in the same way as some other diseases, the severity can be graded based on the degree of urinary retention and the amount of bleeding. It can range from mild, where some urine flow is still possible, to severe, where complete urinary retention occurs and significant bleeding is present. The primary goal of treatment and management is to relieve the urinary retention and control the bleeding. A common initial step is bladder irrigation, where sterile fluid is used to flush out the clots through a catheter. In some cases, manual clot evacuation may be necessary. To control bleeding, medications such as aminocaproic acid, which promotes blood clotting, may be used. If the bleeding is severe or persistent, surgical intervention might be required to address the underlying cause, such as removing a tumor or repairing a damaged blood vessel. Pain management is also an important aspect of care. While bladder clot retention isn't always preventable, particularly in cases stemming from unforeseen trauma or underlying medical conditions, there are steps you can take to reduce your risk. Staying well hydrated can help prevent urinary tract infections, which are a common cause of bladder bleeding. Prompt treatment of UTIs is also important. Managing underlying conditions like prostate enlargement or bleeding disorders can also reduce the risk. Regular check-ups with your doctor can help detect and address potential problems early on. The prognosis for bladder clot retention depends largely on the underlying cause and the promptness of treatment. In many cases, with timely intervention, the clots can be cleared, and the bleeding can be controlled, leading to a full recovery. However, if the underlying cause is a more serious condition, such as bladder cancer, the prognosis will depend on the stage and treatment of the cancer. Research is ongoing to develop less invasive and more effective methods for managing bladder bleeding and clot retention. Newer techniques, such as intravesical therapies, are being explored to control bleeding directly within the bladder. Furthermore, research is focused on understanding the underlying mechanisms of bladder bleeding to develop targeted therapies and preventive strategies.